I already did because I got to do that lovely. And back across. Okay.
There are many diseases in this time and day that are still trying to be discovered, and still some that researchers are trying to find a cure for. Everyone has experienced one of those days where you just want to hide from society because everything is going wrong. However, just place your mindset to where you are thinking about it every day simply because you no longer have control over your body. As humans, we use our imagination to an extreme, but to some imaginations, it is a nightmare that reoccurs on a daily basis. The research that I discovered allowed me to learn and understand what this disease can do to someone and how dangerous it can be for a person. To analyze the situation of schizophrenia, I will explain what the real meaning is, the causes and the symptoms, and the treatments to ease the severity of this disease. According to the article titled, "What is Schizophrenia?" Schizophrenia is a disease of the brain that affects someone from interpreting reality. This disease usually arrives between adolescence and early adulthood, between the age of 15 and 25. It is common with schizophrenia to see patients that are unable to take care of themselves and are isolated from their community. The patient also has a change in the way they perceive things, they have hallucinations, and they become very unhappy. Although a couple of these symptoms can happen to anyone, to become diagnosed for schizophrenia, one must be having symptoms of schizophrenia for at least 6 months. According to Jim Van O's and Kapur Shitishi, authors of the article titled Schizophrenia, 1 out of every 100 people worldwide have been diagnosed with schizophrenia. Since patients with this disease have difficulty taking care of themselves, patients often die 12 to 15 years before the average age of death. This disease is not only subjected to one specific culture, it can happen to anyone in any culture around the world. The cause of schizophrenia is not yet known. Many scientists are working on trying to find the cause of this disease, but every time they think they have something goes wrong. Although, in the article titled Schizophrenia, written by Kim User and Susan McGurk, it states that this disease can be passed through the family, and if both of the child's parents have schizophrenia, there is a 50% chance that the child will obtain it. According to Jim Van O's and Kapur Shitishi, authors of the article journal titled Schizophrenia, there are many symptoms that contribute to schizophrenia, but not everyone that is diagnosed has all the same symptoms. The main symptoms of this disease are hallucinations, which composes of hearing voices, conversations that are not really happening, and seeing people that are not really present, and delusions. The hallucinations often make the patient become crazy and can be very controlling over their body. Oftentimes, if the hallucinations are so bad in one's head, they can lead the patient to hurt themselves or convince them to commit suicide. If they try to commit suicide, they are at risk for being taken to a mental institution or having to arrange living with a close friend or family who can watch after them. The other main symptom that contributes to schizophrenia are delusions, which are beliefs that are not true but to the patient are true. Patients feel like their feelings or thoughts are being controlled by someone in their head and they can't turn it off. Also, they feel like they are being watched and become very paranoid about everything that comes their way. Another symptom that is likely to appear is that schizophrenics become passive, meaning that they do not show feelings or emotions. For example, the patient doesn't become joyful from what they used to enjoy before they became diagnosed. They can go day in and day out with the same feelings, the feeling like they are lost and they are unable to be happy ever again. There is nothing that doctors can do to completely cure a patient with schizophrenia, but there are ways to reduce the symptoms. According to Krishna Patel, author of the printed article titled Schizophrenia, Overview and Treatments, there are 2 different ways to treat schizophrenia. The first major way to treat schizophrenia is through the use of pharmacological therapy. This therapy is through the use of antipsychotic drugs to help prevent the symptoms of schizophrenia to come back, such as hallucinations and delusions. While taking these antipsychotic drugs, it is very important for the patient to remember to take them every day, because once they start forgetting to take them, it could result in them not taking it at all, and they could begin to have symptoms again. Although it seems like using pharmacological therapy should be the only thing that the patient would need, it is not the only option recommended. It is recommended for the patient to use non-pharmacological therapy also, such as going to psychotherapy, but this should only be in addition to taking the medications. Psychotherapy is an option for the patient to talk about what they are feeling, a way to learn exactly what he or she is going through and why. And they even support bringing the family in to educate them also. Sometimes there are patients that are treatment resistant with schizophrenia. The drug that is most effective with this treatment-resistant schizophrenia is clozapine. It is 30% effective when controlling outbreaks, but only with treatment-resistant schizophrenia. This drug is not recommended for any other type of schizophrenia because its health risks and high doses of clozapine could cause something as severe as seizures. Today I talked about what schizophrenia was, the causes of it, the symptoms, and the treatments, so that if you were ever to see it happening in someone, you would be able to recognize it. As I said before, the terror of this disease is real. To be afraid of one's own shadow or seeing oneself as a scary object is losing your mind and self-control. To be human means we are the most dominant species of life. With schizophrenia, the human is no longer in control, the mind is.
It went off.
Oh.